Blood clot warning signs and symptoms can vary depending on their location in your body. Sometimes, they might dissolve on their own, but other times, they settle in places like your heart, lungs, and even brain, causing serious harm if not caught and treated early. Knowing the signs and symptoms can make all the difference. It's like your body sending you a signal to take action. Why should this topic interest you? Blood clots affect over 900,000 Americans yearly, according to the U.S. Centers for Disease Control and Prevention, CDC, and many don't see it coming. In this video, we're breaking down silent signs of blood clots, the biggest risk factors. This can reveal if you or someone you know is at risk, how to prevent clots before they strike, and the latest treatment options available. Stay tuned. We're sharing life-saving tips you can't afford to miss. Subscribe and hit the bell to join the Nutri-Millionaire Health channel because your health is the real wealth. First, what really are blood clots? Blood clots are a natural and essential part of the healing process, but they can sometimes lead to serious health issues. Here is a familiar scene. You get a cut or injury, and your body responds by forming a blood clot to stop the bleeding and help the wound heal. These clots are made up of proteins, platelets, and other blood cells that stick together and thicken. Once the injury heals, the body usually breaks down the clot. However, blood clots can also form inside the body when blood vessels are injured or damaged. These internal clots can block blood flow to vital organs like the heart, brain, or lungs, causing serious complications. The process of blood clot formation, called hemostasis, involves a complex interaction between platelets, blood flow, and other factors. While this process is crucial for preventing excessive bleeding, clots that form unexpectedly or in the wrong places can be dangerous, as we will see next. Next, let's take a look at evidence pointing to the presence of a blood clot. Important notice. Kindly note that all information presented on this channel is based on thorough and relevant scientific research conducted by a medical professional. Common signs and symptoms. Thrombosis is the medical term for a blood clot that forms and blocks blood flow. There are two main types: arterial thrombosis, which occurs in arteries, and venous thrombosis, which occurs in veins, which are low-pressure blood vessels that carry blood back to the heart or in the blood vessels carrying blood from the heart towards the lungs. Note: blood clot signs and symptoms depend on where the clot is located within the body. Arterial clots can lead to heart attacks or strokes, while venous clots, like a clot form in an arm or leg, can sometimes dissolve on their own. However, if a clot doesn't dissolve or breaks off and travels through the bloodstream, it can block blood flow elsewhere, causing an embolism. This can be life-threatening. Venous thromboembolism, VTE, or venous thrombosis, which is a blood clot that occurs in veins, is a term that includes both deep vein thrombosis, DVT, and pulmonary embolism, PE. DVT happens when a clot forms in a deep vein, resulting in swelling, warmth, pain, and redness, though some people experience no symptoms at all. The most predominant of these symptoms is intense pain sensation. A pulmonary embolism is a dangerous complication of DVT. When a clot travels to the lungs, it can block blood flow, making it hard to breathe and damaging lung tissue. Symptoms include sudden shortness of breath, chest pain, a fast heartbeat, coughing up blood, lightheadedness, or fainting. While many PEs are treatable, a large one can be fatal. Surprisingly, up to 75% of people with PE have no symptoms until it's critical. Why PE is a source of concern? It's linked to 10% of hospital deaths. Studies show small clots can damage the lungs, while big ones can be deadly. Arterial clots, on the other hand, can cause strokes or heart attacks. A stroke occurs when a clot blocks blood flow to the brain, leading to symptoms like sudden numbness, confusion, trouble speaking, vision problems, or a severe headache. A heart attack happens when a clot blocks blood flow to the heart, causing chest pain, shortness of breath, or discomfort in the upper body. In rare cases, a clot can form in the kidney's blood vessels, causing renal artery thrombosis. This can lead to kidney damage or failure. Symptoms may include back pain, blood in the urine, fever, nausea, or vomiting. Arterial clots are emergencies because an artery is one of the higher pressure blood vessels that carry blood from the heart out to the tissues. Every second counts. Blood clots can strike anyone, anywhere, often without warning. While some dissolve on their own, others turn deadly fast. If you experience any symptoms of a blood clot mentioned in this video, don't wait. Get medical help immediately. A key question to consider is, how do I know if I am at risk of a blood clot? Several factors can increase your risk of developing blood clots, namely, age. People over 60 are at higher risk. As we age, the body produces more clotting factors such as thrombin, and platelets become more active, making older adults more prone to blood clots. In fact, research indicates that 26.7% of people with deep vein thrombosis, DVT, are over 60 years old. Family history also plays a role. If your relatives have had blood clots or clotting disorders, you may be more likely to develop them too. Prolonged periods of inactivity, such as sitting during a long flight or lying in bed during a hospital stay, can slow blood flow and raise the risk of clots. Similarly, pregnancy and childbirth increase the likelihood of clotting because the body naturally prepares to prevent excessive bleeding during delivery. This risk can continue for up to 6 weeks after giving birth. Certain health conditions like cancer, heart disease, diabetes, blood disorders, autoimmune diseases, and even COVID-19 can also make blood clots more likely. Additionally, some medications, particularly those containing estrogen, such as birth control pills, can affect blood flow and increase clotting risk. Smoking is another significant factor. It damages blood vessels and interferes with the blood's ability to clot properly, further raising the risk. Obesity is also an important risk factor, especially for deep vein thrombosis, DVT, in the legs. Studies show that as body weight increases, so does the risk of blood clots. This risk becomes even greater when obesity is combined with other factors like age or underlying health conditions. Having multiple risk factors can significantly increase your chances of developing blood clots. Conditions like surgery, trauma, diabetes, and high blood pressure are also common contributors to clotting risks, particularly in the lower limbs. Being aware of these factors can help you take steps to reduce your risk. Talk to your doctor about these risks and take preventative action. Now that we know what a blood clot is and its symptoms, what are the remedies available to resolve or manage it? Treatment options. The choice of treatment depends on the type, location, and severity of the clot, as well as the patient's pre-existing health status. Treating blood clots, especially deep vein thrombosis, DVT, typically involves a combination of medications, lifestyle adjustments, and sometimes surgical interventions. The most common treatment is anticoagulant therapy, often referred to as blood thinners. These medications don't actually thin the blood, but instead slow down the body's ability to form new clots and prevent existing ones from growing larger. While effective, blood thinners require careful monitoring because they can increase the risk of bleeding. Common examples include older medications like warfarin and apixaban. Compression stockings help reduce pain and swelling caused by blood clots by improving blood flow in the legs. However, many patients find them uncomfortable or difficult to wear consistently, which can limit their effectiveness. In some cases, doctors may use clot-dissolving medications to break up existing clots, though this is less common. Surgery is rarely needed but may be considered for severe or life-threatening clots. Despite their benefits, traditional treatments like blood thinners and compression stockings have limitations. They don't fully address the risk of clot recurrence or long-term complications, such as post-thrombotic syndrome, PTS, which is a condition that can develop after a blood clot episode, causing chronic pain, swelling, heaviness, and sometimes skin changes or ulcers in the affected limb. It occurs because the clot damages the affected blood vessels, leading to poor blood flow. Up to 50% of DVT patients may develop PTS, making it a significant concern for long-term recovery. Researchers are working on new treatments to improve safety and effectiveness, particularly for high-risk groups like cancer patients, who are more prone to bleeding complications. One promising area of research focuses on targeting a blood clotting factor called Factor XI, which plays a key role in clot formation. New drugs like abelacimab, osocimab, and milvexian are being studied for their ability to prevent clots with fewer side effects. For example, abelacimab has shown promise in reducing clot risk after knee surgery compared to older drugs. Similarly, osocimab has been effective in preventing clots in patients undergoing dialysis, and milvexian has demonstrated a lower risk of bleeding in post-surgery patients. Treatment for DVT usually lasts at least 3 months, but for patients at high risk of recurrence, it may continue longer. For long-term treatment, lower doses of newer blood thinners like apixaban, as mentioned earlier, are sometimes recommended. At this point, are you wondering what you could do to keep unwanted blood clots away? Prevention tips. Preventing blood clots involves simple lifestyle changes and being mindful of your daily habits. For example, if you're sitting for long periods, like during travel or while recovering from surgery, try to move your legs regularly. Simple exercises like stretching and flexing your feet can help keep blood flowing. If possible, stand up and walk around every couple of hours. This is especially important if you've been confined to bed due to illness or surgery. Getting active as soon as you can help reduce the risk of clots. Staying active in general is one of the best ways to prevent blood clots. Regular exercise keeps your blood circulating, making it harder for clots to form. If you're at higher risk, your doctor might recommend wearing compression stockings or taking blood thinners to help reduce that risk. Maintaining a healthy weight is also important, as excess weight can increase your chances of developing clots. If you're concerned about your weight, talk to your doctor about safe and effective ways to manage it. Hydration is another key factor. Drinking plenty of fluids helps keep your blood flowing smoothly. Avoiding smoking is also crucial, as it damages blood vessels and increases clotting risks. If you smoke, quitting is one of the best things you can do for your complete well-being. And if you don't smoke, don't start. If your doctor prescribes blood thinners or other medications, be sure to follow their instructions carefully. While you can't change genetic factors that might make you more prone to clotting, you can take steps to manage other risks. For example, treating conditions like diabetes or heart disease can help, as can avoiding medications that contain estrogen if they increase your clotting risk. Always talk to your doctor about safer alternatives. Have you or someone you love facing a blood clot as a health scare? Comment below and share your experience with us. Blood clots can happen to anyone, often without warning, and the consequences can be life-threatening. But the good news is that being informed and taking simple steps can make a huge difference. If you found this information helpful, don't wait. Subscribe now and hit the bell to stay updated with more life-saving tips. Your health is your greatest wealth, and we're here to help you protect it. So, subscribe today.